Yes, we are live. Hello, everybody. Dr. Vidya here. And before we get on and I introduce this fabulous woman that I have with me, I'm just going to switch off my timer because I knew I had 5 minutes. So I set a timer and I'm just going to check we're live in the right group. So just bear with me. Yes. Yes. Okay. So everybody, welcome. Oops, to this interview video testimonial. And we have the fabulous Dr. Tabs Malik here. So she's been there from the beginning. I'm really grateful that you believed in me. So I just really wanted to share everyone with the phenomenal stuff that you've done. And I'm really grateful that you're also sharing the journey that you've been on, which is so powerful, so empowering, so inspiring. And I think it would be great for others, whether it's the same thing, who knows, that they may be experiencing, or something similar with the same feelings and emotions, and maybe a different story. But just kind of your journey through from the beginning, wherever that beginning for you, and just how we met, and I'll ask questions all the way. But of course, welcome and thank you.
So first of all, Vidya, Dr. Vidya, I am ever so grateful for having you in my life, and our paths have crossed so many times, and I can call you a genuine friend but also a mentor, and you've been there at times when I've needed somebody to guide me the most. And I think and I've been there right at the beginning from your journey and also my journey, and to come all this way is just phenomenal. So if I can do it, just want all your amazing warriors to know, anyone and everyone can do it. And Vidya's the right person for it, because she just empowers you. It's just her energy is just wonderful. So both Vidya and I met at medical school, so we're both doctors together. We've worked in a hospital together, and we've been good friends. And and then once we all once we diverse and started training for general practice, and I was first doing sexual health, etc. Our lives were changing, but they always entwined. We always came back to each other. But my life really changed once I got married, and in a good way. And I had, and at the time in 2017, I had an 18-month-old daughter, and I developed a severe facial paralysis. I was quite unwell with a rare syndrome called Ramsay-Hunt syndrome. That's where you get shingles around the facial nerve, the nerve that supplies the face and moves the muscles of the face. And since then, it's been a really hard health journey. And at that time, with anyone, when you're losing your smile and you're used to working with people all the time, and the first thing you do to introduce yourself is, "Hi, I'm Dr. Malik," and you give a big smile, isn't it? Wasn't able to do that, and I felt that the smile was my identity. But then, I was just so low because, I was on high dose steroids. I was on medication that was giving me horrible side effects, etc. And I just didn't know where I was going because I was in so much pain. For a year or so, I was like this. And I had to, unfortunately, resign from my GP training that I had only 3 months left to do.
Yes.
At the time, Vidya knew about what's going on, and she was guiding me. She was just being this light for me, like sending me good vibrations, and telling me about, don't put your frequency here, keep your frequency there, sending me things on YouTube for meditation. And it was just, just having that support initially was amazing, because things were simmering. I knew that there was something, and it wasn't me being arrogant in any way, but I knew, and this is what Vidya was saying, there is a reason why God or the universe, there is a reason why, this has been put forward to you and your health. Number one, it could be showing that obviously, I hadn't been resting, so I needed to give my body that time to rest, that emotional time to recover. I had lost my father a few years ago before that, and I hadn't had closure, so there were lots of things that were all simmering away. then Vidya was just by my side in that sense. And you know, and she was, at that time she had a baby and she was starting off her coaching. And you know, and I was, you know, I was just so lost in life. And she basically said, you know, you can use this experience to help others. And I didn't know what, you know, she was saying at the time, because it's really hard to get out of that negative space sometimes, especially when you've been so unwell for so long. And then I realized when I went back to Facebook forums with with people who suffer from Ramsay-Hunt syndrome throughout the world, they were all saying the same thing, that doctors aren't listening, doctors don't know enough. You know, there aren't proper guidelines for Ramsay-Hunt syndrome. We feel lost. We feel as if, you know, our face is gone forever. And I thought, gosh, Vidya's right. I need to use this information that I've got. Being, you know, I've got a very amazing position in the sense that I'm a medic, so doctors hopefully would listen to me. I might have some credibility, but I can also put forward the experience as a patient as well.
Yes.
And so it was really hard at first. And I remember with you, and you were like, but why not? You know, I started my Instagram page initially, putting your face out there, especially, you know, in a world where aesthetics is moving forward and, you know, everyone's getting the Botox, everyone's getting the fillers, and putting out your face, you know, and being ready for, you know, ridicule or whatever. I was just like, oh, well, doctors, you know, I was in that low frequency at the time, even then, thinking, would doctors even, you know, think about or listen to me? But, you know, where was I wrong? Because, you know, you know, you said persevere, keep the energy going, meditate. And at that time, because I follow Islam, and, you know, Vidya Vidya is so wonderful because, you know, she believes all religions have this higher power, which I also believe, and it's a positive energy. And, you know, she kept saying, meditate, pray, you know, and I started praying because I hadn't been praying. I wasn't consistent. And I got back to my spirituality as well through her. And, you know, I really owe you for that. And then, you know, I started posting, and really my genuine experience with facial palsy. And, you know, doctors started to hear, my friends started to hear, you know, and I didn't want them to feel sorry for me. I wanted to use my experience to help other people. So that's where it started. And then it slowly grew into, and then I joined your TIR program, I remember, when you were a Bob Proctor coach, and then you started your own with Wealthy Warriors Lifestyle. And I joined that, and I thought that was, you know, it gave me this empowerment because, you know, then I, you know, not even just helping myself in terms of emotionally helping myself, but also my self-confidence and self-image, I could give back to other young girls. Yes. And I mean, if you were to go to my Instagram page there, you know, even just recently, couple of weeks ago, I came back from pilgrimage, and there was this lovely message that I had on a post saying, thank you for this post. Because of you, I've had my surgery done.
Oh my God.
And, you know, and because of this post, and, you know, and that gave me like, oh gosh, this is amazing. You know, I'm not worthy of it. I mean, you know, there's such a greater power than me. And, you know, and for me to be able to help somebody through, you know, through this energy, through this, you know, through God, it's amazing. So, you know, I really owe that, because I wouldn't have been able to think all of this without Vidya's empowering talks and coaching. And then just, you know, and so, you know, and I just thought, gosh, I'm a doctor. Yes, I'm doing this, but I wanted to make money as well. I am a doctor. I am a professional. And it's just not about, you know, acquiring wealth, but it's also empowering myself with the wealth to, you know, so that for a legacy for my children.
Yeah.
And
money's not bad. Money is just what we're using it for. The law of compensation for your service.
Exactly. And you know, coming from an Asian background, it's always been felt like, you know, we don't think about money. And you changed my mindset about, you know, your why aren't you charging tabs? Because, you know, this is not, I don't charge for my facial palsy, but I, you know, for what I was about to do, you were like, you know, you said, but you have gained all this experience of 15 years.
Yes.
So they're not just, you know, it's not just for that particular 5 minutes, 10 minutes. It's all that experience that makes you unique for
Yeah.
who
The
you
impact.
are.
The
Yeah,
impact. What I love for time.
exactly, the impact
Yeah.
that, yeah. And I got that from you, and that was just, you know, that it took time to change the mindset, but you know, you kept persevering, Tabs. You know, and and you know, I finally got there, and then, you know, it was a slow progress because I had this image of what I wanted to do. I had been praying, and then, you know, it just came to me like, this is what I wanted to do. I wanted to set up my own, like, because I had changed my lifestyle, I had lost weight, and I wanted to initially use all the information that I had gathered to help other people do the
Absolutely.
same.
Absolutely.
And then I thought, okay, how am I going to go about it? Because initially I was just, I had so many, you know, self limitations. I had so many self limiting beliefs that you were like, you know, you said, well, this is just something that you believe in. You know, you need to change your perspective. You need to, and, you know, it took time. It was slow steps. And then I thought, what are the steps to get to my goal?
Yes.
I wrote my goal down, and then, you know, I slowly worked towards it. I slowly did the courses I needed to do. I slowly found out about how to open a business, how to, and I used your techniques and, you know, your course, and you know, and it was amazing because you were guiding me, and, you know, how to create your own page, how to do website, etc. And then, you know, I I finally did the diploma and everything I needed to do. And then, you know, I was just waiting around, and I didn't know what, you know, last year I was ready, and I was just like, why am I waiting? What's happening? And I kept thinking, oh, you know, my son is so young. Sorry, I have another child. So my son it just turned 2 in October, and I thought, oh gosh, he's so young, he hasn't started nursery yet, he's COVID baby, you know. And I had all these things going on in my head, like, you know, what mums think about the guilt and etc.
Yes.
You know, so much guilt, so
Because
much guilt.
strong.
And I was like, oh, should I be even starting something right now? And then I went for a pilgrimage and to Mecca over December time, because I wanted to take the children, I wanted to go with my husband.
Nice.
And, you know, and it was just so nice. I was at so much peace, and I was praying to God, and I was, you know, asking, and, you know, saying, is this right for me, is this the right time? And I, you know, and I was just getting good vibes. And then I came back and I spoke to you, and you said, well, Tabs, you've gone to a place where it's so much positive energy, because there's so many, when, you know, people are praying anywhere, and
Yes.
there's so much positive energy, and, you know, you get that frequency from there and everything. And then I just thought, what am I waiting for? And I just did it. I just, like, 3 weeks ago, 3.5 weeks ago, I was awake, and I said, I want to do this production because I've got everything done. Let's do this. So I made the logo, started my Instagram page. I was like, bang, bang, I'm online, and I'm going to do this. And I've started. So, you know.
And what have you started? Because I've not been on this journey with you. So
Sorry.
it's
So
called
it's my weight management clinic. It's called the Vibe Clinic. The reason why it's called the Vibe Clinic is I wanted my daughter, well, vibes because of Vidya's vibes, good positive vibes, but also because I was asking my daughter, what should I name my clinic? And she said, Mummy, the Vibe Clinic, call it the Vibe. And she's the one who's
really?
she goes, because Mummy, I want all your patients to give you good vibes, and you're going to give them good vibes. And she said that, and I honestly, and I had no, like, I was just like, oh, what a cool name. But is, you know, my husband was a bit skeptical. Vibe, what are we doing? Vibe here, but but I was like,
That
you know
is
what, I'm just doing it.
amazing.
Yeah.
How much you've taught her also.
Well, I don't know whether she's, I don't know about teaching, but I think she's
You have.
absorbing
For
everything
example.
we talk about, and we're live. So she
Yes.
takes all of that in, which is
Yes.
another thing that is so positive about this. So, you know, and I've always wanted to both my children to be at a different energy and a different frequency, and think of things, you know, where nothing is impossible. So that's what I, you know, and that's what you've always said as well. So nothing is impossible. So this weight management clinic is, you know, it's a holistic approach to lifestyle medicine, using lifestyle medicine and a medication to help with weight loss, but it's all evidence-based, it's all up to date, and I genuinely care. So it, you know, it's a bespoke tailored package, so I will actually genuinely listen to you, get your frequency, and also coach. So I've just, this self-image coaching that I've gone through myself.
Thank you. Yeah.
I'm giving that back. So that is also my way. So that's what, it's a unique package. It's not something that people will get anywhere else. And then on top of that, I've got a separate small business that with a different company, and it's to do with gut health. And so I'd like to, if certain medication and things are not suitable for clients, then I would always, I can actually talk about the gut health program and 30 days and all of that after, if one thing's not suitable, I've got other options available for them. So, and guidance throughout, my support throughout.
Amazing.
So yeah, thank you.
This is incredible. Yeah, and also the fact that you've added in the self-image piece, because yes, we call it weight loss, but obviously no one wants to use anything, but it's the body image.
Absolutely.
Where you are now, alongside the best health.
So it's a bit of everything in my packages. So
and you're right, I don't think I've seen that anywhere else, right, where you have both.
Yes, and plus, I did the diploma in nutrition as well and functional medicine. So I literally reach the core and find out what's going on. So because there's so many different reasons why people gain weight, etc. So it's not just one thing, and it's not one size fits all. So yeah, I'm so sorry, my son is on me at the moment. So running around.
Well, this just shows how this journey you've been on, and it hasn't actually been that long, because we spoke in 2020.
Yes.
Yeah, it was during the COVID pandemic. All of this going on. It was also the pandemic.
End of 2019. That's when I had all that.
And you were pregnant, also looking after kids. Husband also working really, really hard. He's a doctor.
Yeah,
working really, really hard, and at times, obviously, you manage the kids as well, though he's very hands-on as well.
I mean, exactly. And your program helped me with my relationships as well. So the relationship with myself, it takes a lot. So when you lose something physical about yourself, so even whether it's the face, with me, as I said, it was my facial palsy, or losing something physical or getting hurt or fractured or whatever, your self-confidence can go down, and there are times where you just don't want to look at yourself in the mirror, get dressed up, and it again, you helped me with that self-image and changing that into loving myself no matter what. I am me because for a reason, and this has empowered me even more, and it's just thinking in a different way and believing in a different way. Thinking and believing, first you think, then you have to believe it as well. So that comes later, but it did, and it really helped. And then the relationships you mentioned, my husband, my children, absolutely, because I wanted my daughter especially not to grow up with all these beauty images around what's perfection, etc. So I've really tried to say everyone is beautiful in their own way, but you are beautiful for who you are, the kindness, and for being a genuine person, so that's it. And then with my husband, it's just because I didn't love myself, I you get those insecurities, but then I have loved myself. I've got so much that for me I bring to the table for myself. I make myself happy. So and then I have that strong relationship. I'm lucky enough to have that strong relationship and a friendship with my husband. But so and we talk about everything and things that I hadn't been feeling happy about, and so communication is also key, and that's what you taught me. So
absolutely.
So these are the things, and I think your program, I'm sorry, I'm just carrying on about how wonderful you are.
No, it's great. Thank you. I'm
you're
really
not just a friend, you have been my mentor, and honestly, there are people cross your paths for a reason, and you have crossed paths with me at every step, and I think it was all to lead to this and even greater things, hopefully.
Absolutely. Yes, definitely.
So absolutely, definitely. So so that's my journey.
Amazing.
Sorry, I've spoken so much.
No, it's lovely. It's beautiful, and I'm so grateful, because I think this is why I wanted to do Like, I know you're like, I've been testimonials from you in the past as well. So thank you for that.
More than a pleasure.
See it live like this, I think is really empowering for other, it's not even just about women, but anybody who may have a different story or the same story, but may have similar feelings of disempowerment that we often put on ourselves, or maybe unfortunately others are, saying to us, but it's a choice.
Absolutely.
And it may not feel like that at the time, but actually you honestly can live the life that you want. And be in your best health and wealth and the way you contribute to the world, and also your relationship. But it starts with a relationship with you first. And also it's about stepping into that power. It's like one of the modules is awakening the warrior within. That's why I called it warrior. So it's not hustle and grind. It's actually just that resilience and strength to actually, ironically, the courage to be yourself.
Yes.
And I think it's beautiful that this is so, at the moment, this is being streamed live into the Heal and Release Masterclass. But actually, so, because it was initially a healing journey.
Yes, it was.
But how you can actually take something that was initially using our mental faculty of perception to be perceived as difficult, or these thoughts that you were having around it, but you can change the meaning, and actually it's become your superpower.
Yeah.
Right? It's become your superpower.
Absolutely. Yeah.
And genuinely feeling it, not just words that we kind of feel we think we should say about ourselves, actually like looking in the mirror and be like, yeah, I'm a badass. And I am a superhero. And also when those feelings do crop up, because when our human comes out, or when we have some of those thoughts, then emotionally regulating it, so we're not scared of fear. We're like, okay, fear, like, is there something here that like really is truth, or is this just an emotion, like a passing cloud, that it's like, okay, it's just like an old little remnant thought that is not actually, I'm not giving it any meaning. It's just like a passing cloud. And that's very empowering, because otherwise we just kind of jump into it, and it goes, when you're creating all these incredible things, including children. creating clinics, creating a whole new self-image. And when we say self-image, it's not really the external, isn't it? It's the internal.
It's thinking and in the heart.
Yeah, and that's in the heart. And I just want to tap into something that you mentioned about you had an image in your mind and then you prayed.
But I was praying and then I got the image.
You prayed and got the image. Okay. What was the image?
I remember I was in Belgium at the time, and I remember I messaged you because and I said, well, because I was in a two minds, and I didn't want to let go of my general practice training because I had worked so hard for it. And you had to, it's a chapter that's closed, but then you have to move on to bigger, better things. That's right for you. And I didn't know where I was so lost. And I was praying to Allah. For me, it's Allah and the Almighty. And in there, I just closed my eyes and I saw that I was in a clinic. And at that time, there was no concept of me having a second child. And I was actually feeding my child on the high chair. He was on a high chair and it was all white. And it was just, I was feeding it. And then my husband was there, my daughter was there. But I knew that I was in a clinic and I was doing it myself. And that's what I saw. And it was so amazing. And then I remember I messaged you. Honestly, that's exactly what happened. I just gone for my husband had a spinal surgery conference at the time, and we'd gone to Belgium, and I had to just decide what I was going to do with, because health is wealth, basically. So you've got to look after yourself. And at the time my daughter was so young, and my husband said, well, you need to look after yourself so that you can be there for us, basically, as well. And at that time, I remember those words, general practice wasn't serving me, although it's a very noble, very beautiful profession. I have utmost respect for it, but at that time, because of my health, it was not serving me, so I had to let it go. And
also just changing the meaning on that, also that there's so many ways of serving, of healing, of providing that service. Like, you know, like after we finish, I have like my afternoon GP clinic. And I find that most of the stuff that we're talking about is exactly the same. Like if someone's coming up with their anxiety or mental health, or even sometimes they come up with their bloating, and I'm like, somehow, like we can get self-image there somehow. But it depends on the but often I can see how it is tied into. There will always be like when I kind of tap into the emotional health, then I'm like, they'll be like, yeah, there's some work stress going on, or there's this, or they go through some merger. Or always tied in, but our perception is that, oh, it's just like a stomach bloating issue. Work out like how it's been going on for so long. And then when they say it, they're like, wow, yeah, actually it makes sense. And even some of them are like, no, we'll do the gastro referral next time. Like, can you do the one for like, you know, therapy, or, you know, obviously I don't really go into my coaching there because it's a different idea. But still, I'm like, okay, well, this is like the closest thing. But to just talk about the thoughts, and I get them to journal and
amazing. That's really good.
Yeah, I book in next week, read this book, and I give them homework, and most of the time they turn up. But it makes a huge difference. The ones that do decide to show up for themselves and have that awareness, because you do have to have that awareness piece.
Absolutely.
It's life transforming. And so you can still do the physical things and you know, do the referral, or like whatever it is, you do that. But actually you realize the power in that. That's why I call my modules Heal and then Empower, right? And then awaken that warrior within, you know, and then you rise and thrive. So the conversation I'm having is exactly the same. And I'm like, it's just maybe their paradigm that for whatever reason, the universe felt like, do you know what, this particular person, the journey they're on, they're only going to listen to you because you are a GP right now. That's just their understanding of healing and health. But it's the same conversation that I've literally been having in my Heal and Release masterclass this week. It's no different. Yeah, exactly the same. And so it's just interesting that there are some people that will come and watch my YouTube videos. There are some people that come and do Instagram or my podcast. There are some people that will see me as a GP. Sometimes when I do like my NHS locum work, I'm an appraiser as well. So sometimes it will be a doctor who's like burnt out and really going through like a lot of stress. And they may not come to me for coaching, like necessarily like yourself, but it's, you know, so yes, it's an appraiser.
But you're applying and using the
slightly different, but yeah, so it's interesting. So for me, I see it as multiple sources of income and multiple sources of service,
absolutely,
and inspiration. But it's just I'm serving in the same way, right? So I'm just here to share with the world. And some people want like the high ticket 1 year long mastermind, 20K, and some people want to watch a YouTube video. Some people read the books. Like it really is like.
Sorry to interrupt you, Vidya.
Yes.
Book. I forgot. You know, you had always said use your experience to write a book.
Yes.
My book is nearly written.
Oh yes.
It's taken me a lot longer than yours.
It's not about that. It's not about that.
But with me, it's rather than just writing about my experience, because I think there are lots of people on the forums who have done that, and you know everyone knows about the medical side of it.
Yeah.
What I've done is actually, well, it's going to be released soon. It's basically a type of journal for full facial palsy. So it's their journey and documenting everything so that they know that when they have to have a follow-up, they know, oh, right, you know, I've done my physio today, tick boxes. Yes, I've done this, I've done that. So it's like a checkbox for everything.
So it's like a workbook.
Exactly. It is a workbook for facial palsy. I just thought this would be a unique way, but it's actually, you know, again, empowering yourself.
Yes.
And taking control of your own health. So basically it will actually lead you towards, okay, have you, you know, you've got pain today. Do you need to take painkillers? Do you need to contact your physio? Do you need to speak to your neurologist? So, you know, there are things in place for that. So
that is incredible. And you know what, this is what, like I was saying one of my patients earlier, when I was doing my morning clinic, about how you can still have the physio, the pain management team, you know, whatever it is. And it's not, because sometimes they go the other way. Like, I don't know. Yeah, I don't want any medication, doctor. And I'm like, no, that's not the point here. The point is that I am so happy and grateful to receive healing and health, the best of health in any and all forms, like however it's meant to be. So, so then you have the medication or the surgery or whatever it is, like with gratitude, right? Absolutely. And actually, talking about the different, you mentioned pain management there and physio, how you maintain yourself as the conductor, and each of these are just different healing tools, like a different instrument, like the physio, the pain management, even your
Absolutely.
medication or whatever, the meditation, journaling.
Yep.
And then you're the conductor. So you're just deciding what's the best kind of combo. You ask them for their advice. They can kind of, sing a note by themselves, but it's more like you're bringing it together in the best way that feels good for you, for the best health, best healing, whatever that looks like to you. And I think that's beautiful to have the workbook, because then sometimes you need to see it, and to gain clarity. It's basically like I've got my mental health workbook coming out next week, which is exciting.
Oh, is it? Oh,
yes, it's coming out next week. But it's the same kind of thing of
amazing.
like, sometimes you need, thank you,
To track
understand.
Exactly, and to see how far you've come. So it's also to encourage people. So if they, if they've got a low day, they can go back and track. Gosh, I was there and now I'm here.
Yes.
So it's also like a little tracker of and and also to keep all your clinical notes in place, and so that and then after. I've got a little section where sometimes we forget what the doctor has said to us. So it's also a little diary for you to come back and say, okay, so the doctor had said this, and the next time I'm going to ask these questions to my doctor, GP, or consultant. So it's just a record keeping as well. So
amazing.
But then I got that from you because you said there's so many different types of books that you can write, and and the way to write it and just do it, and so that was also part of your course. So it just took me a little longer to get there, but
that's fine. I mean, when I say, if anyone's watching this wondering, so this is their How to Become a Published Author program.
Yes. So I've done most of the programs with Vidya, and I think to get the maximum benefit for your life, please, I'm serious, do all her programs, because they're phenomenal. They really will. Like, look, if I've come from like literally, I was really lost in life to like doing so many things at the moment, touch wood.
You don't need to touch wood, because you have an infinite connection with source, through Allah, or however you want to do it. So you have an infinite source. So I know we say things like touch wood, but that's actually part of our scarcity mindset, that only if I touch the wood,
it's still
nothing stable. I'm just joking, but can you see how it comes in our speech?
Absolutely.
Touch ourselves. Now I'm like, I don't need to touch wood. It's within me. Like he or she or however it looks to you, is always within me. It's a part of me, and that's empowerment as well, right? So but so that's the How to Become Published Author program. And you can do it like I did it in a week, but it's not about that. It's just to show that power again, that
you're going to be serving other people with the knowledge that you have, or whatever you want to write about. People will want to read it, and it will help them in some way, which is amazing.
And it helps yourself, don't you find?
Yeah, absolutely.
It helps yourself to identify your healing journey, like what helped me and what helped other patients, and that gives a lot of clarity. So before I let you go, because I know the little one wants you,
I'm so sorry.
Just gone a bit. No problem. Just finally, just in your healing journey, right? What would you say are the most powerful tools or thoughts or mindset or affirmations, or just what was it? Just upon reflection, that's really empowered you, made you just feel like warrior strong. As we
my strong, obviously it was your coaching, but the belief system was having this strong belief in whatever happens will happen for the best, and leaving it all for the higher powers, because my heart is pure and clear. Even now, if there's something that I don't understand, I leave it to God.
Yes.
I leave it, and I just follow through. I literally just follow through it, and I just keep positive, and being grateful for what you have now. Because what I learned the hard way was, because I was always striving for, if I had this, I'll be happy. If I had this, I'll be happy. If I have just 2 children, I'll be happy. And it wasn't about that, because, living your life for the future, there's no point. Why aren't you? Because life's so short as well, in the sense. Live your life for now.
Yes, absolutely.
So that,
live your life now and we can live a long, happy, healthy life as well.
Absolutely.
But
wear the clothes that you've been saving for. Don't wear, don't wait for the special occasion. Wear them now. Enjoy yourself. Feel good about yourself.
Absolutely, absolutely. And it's not because it's going to like necessarily end tomorrow. And if it is, then that's fine too.
It's not about that. It's about the energy that you're creating, being and persona, etc. So yeah.
Absolutely. Well, that's so beautiful. So thank you so much. I really, really appreciate it. There's so much more.
I really appreciate it.
This is, when I was doing my visualization around coaching, I think we talk about this in the Legacy Creators around, there's a lot around, your ideal client and your avatar and all that kind of thing, which is good. But really it's that energy. And this is what I was asking for and visualizing, which was like it's not just a business and earning money, and there's nothing wrong with that, but it's a byproduct of, it's called the law of compensation, right? So it's the way in which you are serving in the world in these multiple ways of service we talked about, like either becoming a coach or like your online healing, how you want to do it, or courses or whatever it is. But it's about actually how you are then compensated for it. But it all comes down to your own belief system if you actually think you deserve it, including, do you deserve healing? Do you feel you deserve the best health, the best wealth, the best work? Not the best as in competition to others, but compared to
yourself.
Yeah, absolutely. So the healing journey can be in any of the pillars: work, health, relationships, but it really comes down to your relationship with health, your relationship with yourself, your relationship with money and work. And I had some people messaging me about how they are a doctor, they got MBBS, but now maybe doing PLAB, or maybe there's a health issue or something, and it can feel at the time like, well, I don't know, that's it, what would I do? Because sometimes we're surrounded by people who are just in the same paradigm, the same belief system, and we kind of need to look outside of that in order to gain clarity.
Yeah,
that it's not just about this. Even in your healing, even if it feels like this is it, like it's all kind of, it doesn't have to be that way. And obviously there's experts for the physical health, but it really, again, it starts in your mind. And again, I would say the power is visualization, meditation, which is basically what prayer is, right? You have an image in your mind.
Exactly what it was. I personally think, the vision that I had during my prayer was a visualization, because, I was thinking, I was praying and I was thinking, and it came to me. So that was literally, it was visualization.
It is visualization. And I mean, it doesn't matter what people call it. It's whatever you want to call it that feels good. But the point is it's that connection with, whether you want to call it source or Allah or spirit or whatever, but it's that connection. And actually that connection is always there. It's actually that we're just renewing it because we've kind of temporarily forgotten. It's not like Wi-Fi, like the connection gets lost. Like I'm looking for signal, I'm looking for God. It actually is not. It's always there. But we're tapping into it. And that's what I mean by wealth consciousness. It's money, yes, but it's more about your prosperity in even spirituality, right? That belief, that inner knowing that you talked about, like, I'm just going to hand it over to the high. That is faith. That is trust. And that is those higher emotions and vibration. That is wealth. That is wealth consciousness.
Oh, absolutely.
And some people call it Christ consciousness or Krishna consciousness. I don't know if there's an Allah consciousness, but basically it's the same thing. It's that feeling of, I just know it will be fine. Yeah. And I don't know what the how looks like, but I know the feeling of peace of mind, which is the opposite of anxiety and fear and doubt that we're feeling. And that trust within ourselves, to then take the faith action. And it's not massive action. It's just like you said, I was just sitting there like, why do I do this? I'm not sure. But it's again, it's that belief. It's us holding ourselves back sometimes. So, well, thank you so much.
Oh, you're most welcome.
And, thank you to the little monkeys there for letting us have your mummy, your amazing mummy. And this is really, this program's not, I think I tend to attract, a lot of amazing, beautiful women like yourself, but it isn't just for women, it's for anybody. Yeah. But I think it's very empowering, for women to see this, for women. Absolutely. Because sometimes there can be certain cultural paradigms around how motherhood should be, maybe how your career should be as a doctor or whatever. And I think sometimes we need to drop these labels. Well, yeah, we need to drop these labels, but equally, if you're enjoying that label, there's nothing wrong with that. No. But you can embody it with your own definition of what that means.
Agreed. Absolutely.
right? Like, you don't have to be a doctor to help people,
No.
actually.
And I remember you saying that, and it was hard for me initially to accept that. But then, it comes, as I said, it comes with the flow.
Yeah.
Just believing in yourself, believing in the higher power, listening to you, believing in what you're saying. It definitely.
Lovely.
So, yeah.
Great. Well, thank you so much.
Thank
Well,
you
those of
again.
you that, no,
Thank
thank
you to
you,
the
darling.
audience for listening.
Yeah,
Thank you.
no problem. It's very, very, it's a pleasure for myself. So I'll let you get on with
Thank
the
you.
others, and we'll definitely catch up soon. And I'm looking forward to the launch of the Viper Clinic very
Yeah.
soon. Yes.
Thank you.
Great.
Yes, you'll get
All
an
right.
invite very soon.
Absolutely. Looking forward to it. All right. Take care, my lovely. Thank you. Take
Bye.
care. Bye.
Bye.
Okay, so that was the phenomenal Dr. Tabs Malik. So she's incredible. Yeah. So I just wanted to really show you about how, just checking the time because I was at my afternoon clinic as well. In just a couple of minutes, but just the power of drop these labels that you have around yourself, right? Really, like you're looking, sorry. Let me have a cup of coffee. Okay, it's all fine now. So it's in my mental health workbook, which is coming out next week. Okay, and I posted a lot of the questions, like in the Healing Release Masterclass. You've basically got like the kind of draft manuscript, and I deliberately haven't made it super long because when you're like, oh my god, this thing is going to really help me, and it's like so many, like the encyclopedia, and you're like, oh my gosh, it's like I don't want that paradigm of like it's hard work and it's going to take ages for me to feel fully healed. Like you can make a decision that I'm fully healed right now with whatever situation it is, which everyone's going through, right, by the way. Okay. So don't feel like, oh my god, I'm healing, like something awful has happened, because that narrative, I don't mean that not with empathy, but that narrative sometimes isn't so helpful after a while, right? When we want to feel empowered and strong and I'm now victorious. But a lot of people don't realize, it can go the opposite. A lot of people don't even realize that they need to heal something. So they don't even have the awareness of it, right? So how can you heal from something, self-heal, with some help from experts, right? That's fine. But how can you do that if you don't even know you need to do that, right? Like some of the patients I've seen this morning, this week, like they think it's just abdominal pain or it's just bloating. Obviously, we do the tests and the scans and blood tests and stool tests and all those sorts of things. Yes, some of them, do need a referral to experts in this, to absolutely, and and often may need a procedure or some other things. I'm not saying you don't do that. What I am saying is the power starts here. Okay, and this is bigger than mindset. This is bigger than just words. This is a real deep inner knowing. This is what I mean by faith. You can attach a religion onto this, and often if you've been born into that, like I was born into Hinduism, Tabs was born into Islam, it kind of, for me, doesn't matter. It's like Google Maps. Okay, you get to the destination, which is peace of mind. Okay, some people call that I'm reaching God, or faith, or spirituality, or Atma, or Nirvana, or heaven, right? Like and some people say heaven on earth, which for me is peace of mind. Do you see what I mean? Can you see how you can use your mental faculty of perception to alter the meaning that you are giving to this person, situation, event, even symptom? And because of that, when you have absolute full faith and trust, you can actually change your reality. Why? Because you start taking different actions. Okay. You start taking different actions. You start moving your body differently. Okay. The way somebody, regardless of whatever's going on pathologically, okay, on a physical level, the way somebody moves when they think that they are unwell is very different. Whatever the condition is very different to somebody who thinks to themselves that, and they basically made a decision that I am so happy. I am, right? Not I will be, I hope one day, maybe, I'm not sure. No, none of that. I am. Can you see I am? I am. It's like a decision. It's like done. It's like there's no discussion. It's just I am. And it doesn't matter what other people think. They're like, yeah, but are you sure you're healthy? Like, what about this and what about that? And like, it's just, and you don't even need to be like, oh, I mean, you might want to, but it's more about all that matters is what I think. And yes, there are experts in this and in that, and I want to know their opinion, right? But I also want an expert who has an understanding of the mind-body connection. I think most of us do now, but has an understanding of that and can empower me with that and the way in which I choose to do this healing journey. So there is empowerment in that as well. Okay. And the number of, my gosh, the number of clients and patients, or however I've seen them, whether it's as a GP or a coach or even people who've read my books, the number of people who have been able to heal emotional, physical health, so relationship, divorces, really toxic situations where people have transformed, have, I don't know, rehabilitated, if that's the right word, or whatever it is, but have had a spiritual awakening is another way of looking at it. And people who have stopped their divorces. Even I've had clients on here where they've stopped their divorce and they're now living a beautiful, happy, loving marriage. And parenting issues people had with their teenagers and kids. So people and health issues as well. Symptom control, palliative care patients who've also done the Wealthy Warrior Lifestyle Program, alongside obviously their physical health regimens, etc. So I'm not saying you don't do those things, but the power of the mind is strong. The power in faith and trust in whether it's a higher source or it's inside, or you call it, or somebody may even just call it self-confidence. But it's whatever meaning, whatever way you want to reach that, doesn't really matter. It's whatever you believe. As long as it's good for you, right? We're not just randomly attaching meaning and belief in something that's not good for us, but we're like, oh, as long as I believe it, that's all that matters. No, I'm not saying that. It has to be in alignment with the laws of the world that we live in. But I'm talking about the universal law. I'm not talking about laws just, there were some laws from the 1980s that were like now, right, they're now being like changed because they're like completely unethical, to do with like racism, etc. Right? So, and human rights. So human beings from the past often made decisions based on lack of awareness. And even now, right? So it really is about, what do you think? Right? What do you think? Not what do I think about you? Not what does your spouse think about you, your mom, your kids? Like, yes, it would be lovely if everyone had these beautiful opinions of us, okay? But really what it comes down to is, what do you really think about you? What is that internal dialogue that's going on? That's what you should listen to. So when you're going to go and do something, like let's say after this, you're like, yeah, I feel really empowered. I'm going to get the book. I'm going to work through this. I'm going to open my clinic. I'm going to do this. That's your intuition. That's like bang, 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 go, go, go. That's you, and your connection with source. Now, when you suddenly get the second voice or thought or feeling that's like, oh, I don't know, I'm not so sure, or maybe it's different for her, or I don't know, or they might think this, or but this, whatever comes after the but, I didn't mean to make that like a but whatever comes after the but is your limiting belief system, right? It might be about your spouse, right? It might be that, oh, but I can't do it because, my husband won't like it. And they may have even said that. But sometimes you're giving so much power to that. Power to that is another way I say this is when you water the weeds. I'm not saying that they're a weed. What I mean is the situation, the way you are perceiving this is like it's a weed in your mental garden. And you're literally watering it. You're just making it stronger and grow, like growing big, like the little shop of horrors. But if instead you water this beautiful idea, like Dr. Tabassum have of my vibe clinic, weight loss, or optimum health, let's call it. If you don't like the word weight loss, that's fine, but let's call it optimum health, of having another kid or whatever it is, then that is what you want to water, right? That feeling, when you had that feeling of inner knowing and trust, and I felt so good, that peace of mind, it may have felt 30 seconds and the rest of the day was just worry, anxiety, fear, doubt. Okay, I get it. But that moment, it doesn't matter how big or small, that's just the law of relativity. Look the stuff up. pause it, watch it again, look it up, and learn. And we don't want to just learn all this for our conscious minds, what we do as doctors, put all this information in our head, and then like, can I have a certificate to upload to my appraisal? Okay. It's not about that. It's about the implementation into your life in your 3 different life pillars: health, wealth and work, and relationships, starting with a relationship with yourself. Right? This is the implementation age. Okay, we don't just the people that get the best results in life are not the people that have just consumed a lot of knowledge. There's a lot of very well-read, very well-educated in the conscious mind people out there who really don't have very good character, but they're very knowledgeable. I mean, trivia, what's it called? Knowledge, trivia, quiz, whatever it's called. They're like amazing. What's the point? Who cares? If you don't have very good character and you gossip about people and you don't really carry out your dreams or listen to your intuition and you shut down other people's ideas, or when they're like feeling empowered, or like, who cares? Like, you know, the president, like whatever, I really don't give a crap. So it's about character, okay, and not just collecting information, and how you're using that to serve the world, starting with yourself. Okay, so that's saying, you know, charity starts from home. So obviously, don't see yourself as a charity case. I'm not saying that. But what I mean is, it starts with yourself, right? Like the airplane, the emergency little flyer thing that they have. You know, the parent has to put the oxygen mask on themselves first, and before they put it on their kids. And that's not you being horrible. It's because those kids are what's going to happen to them anyway if you're gone. Right? So you has to start with you. You have to fill your cup first of caffeine. Nescafe, thank you. Oh, my kids still want me to sleep. That's another story for another day. But that's what you have to do, to fill your cup up first to the top. Fill it to the brim with self-love. What does that mean on a practical level, right? Because people say these things. It means, sorry, I can't answer your call right now. I'm in an appointment. What is the appointment you're in? You don't have to tell everyone. The appointment is the appointment you've made with yourself for the next 1 hour. I'm just going to meditate. I'm just going to lie down. I'm going to put my headphones on, so I keep it next to me. And I'm just going to listen to this affirmation. I put it all into the group. I'm just listening to this affirmation. I'm just going to listen to this podcast about healing. I'm just going to, like, whatever. I'm nourishing my mind. I'm staying in my vortex. I'm safeguarding. Okay. And if that person who's messaged you is someone, you know, your intuition is telling you, oh my gosh, that's the opposite of healing this person, I suggest that you are not able to get back to them maybe for the rest of your life. Okay. Sorry. Okay. The next thing, practical level, is obviously they're going to have a fight with anybody, but maybe just I would strongly advise you start to just distance and just be very busy. And naturally, remember why? We're not watering the weed. What happens when you don't water something? It just withers away. Eventually, they'll just like go away. And then the next thing, you might be like, oh, this live masterclass is on at this time. Oh, but I've got clinic. Okay, do you know what? The old version of me? Oh, sorry, I can't attend. That's it. Or you'd be like, interesting. I might actually just pop an email to HR or whatever and just see, is there any chance that I can like move my clinics around or do this or do that, because I've got a really important appointment. Again, it's attending this live session, or some of my clients in the Wealthy Warrior lifestyle, where we do all of this, by the way, like on steroids. Like there's no steroids in the program. But what I mean is, this is a deep life transformational program, especially if you're in the year-long mastermind, where you get like monthly healing sessions with myself and a deep one-to-one embodiment work. But there's also the 6 month where we do it in a group setting. It's all confidential, so don't worry. But that's group, and that's weekly. So what some people have done is they're like, well, this is going towards my goal, right? For peace and healing in my mind, body, and soul, my relationship, and I need this. So I'm going to ensure I attend live. The replay is always there, so don't worry. But I attend live because I want to feel this live energy that you're feeling right now is a decision. Okay. So that is like, okay, then I'm attending the session. I'm going to read a book, right? I'm not just reading any willy-nilly like magazine. You want to nourish your mind. I would strongly advise you don't listen to the radio, you don't watch the news, you don't read, I stopped watching Game of Thrones after a while. As soon as they started like stabbing people, I was like, this is not entertainment. And so there are a lot of things which, you know, like I love my hobby, but I'm like, I don't want to watch this. This is not entertainment to me. And I'll watch other things like mainly comedies, and which make me feel good, right? And I feel like this is, your mind is like a baby sometimes, like it's like a toddler, to literally just absorbing it in. Like, would I show my 3-year-old like some horrible horror movie? They would just believe it as if that's true. So yeah, no, I'm okay. So I might be like, oh, I might read. What am I reading at the moment? I'm literally just showing you live, like practical, like this is my life. I practice what I preach. Okay, so I'm reading this book, God Works Through Faith, because I'm also like, what does that mean, faith? I'm not questioning my own religion, like it's just getting strengthened even further, right? And it's not fixed to like, you have to be vegan, you have to be vegetarian, you have to be vegetarian on like Thursdays, or between 12 and 1 you have to just eat a banana, or whatever. Like I'm not ridiculing, I'm just saying for myself, like there is different ways, and you can always have that feeling of knowingness. And I found this beautiful list. I made a podcast about this, by the way, podcast episode on strengthening your faith, so I go into the details there. I'll maybe post that into the group. So I'm reading that, and look, I'm like really studying. I'm like, I'm not saying I know it all. I'm really studying. You see, highlighter. This is it. I've got my journal here, right? In between patients. So I've got 5-10 minutes journaling, working on my own introspection. When I say journaling, there's actual specific questions you answer. You're not just randomly writing stories. There's a way you do this. This is what we do in our embodiment sessions every single week. Super powerful. I don't know anyone else that does this. Okay. That is also like a doctor and a coach and an author, and actually won awards. This is an award-winning program from the National, this is British, UK, sorry, National Association for Health and Social Care. And I was runner-up, and the number one was Manchester University Hospital. So I think I did pretty good, you know, to come after that. So it's an award-winning program. It's phenomenal, and that's Wealthy Warrior Lifestyle. And there is also the Legacy Creators Program, which is more around what Tabs did. So creating entrepreneurship, basically creating your legacy. But it's very healing to then transmute everything you've learned in lifestyle. And you're normally, most people at lifestyle are at a crossroads. They're like, I want to change career, or I want to do it in a very different way. I want to take it online. But they're kind of like got all these beliefs and blocks, and they like normally they get a divorce or like some huge health issue, or maybe we've had a couple of domestic violence, or just all sorts of various things, or huge relationship issues, or just like financial issues, and they've just like enrolled, often on credit card, or they're like, I need to just get in here. Then we have payment plans as well, and they are then like, because then they unblock all of that holding them back. It's like a dark, cloudy storm. And they've kind of forgotten that the sun is just shining here. And what we do is just remove all of that. Okay, they realize huge empowerment. That's why one module is literally awakening the warrior within. Remove all of that, and also know that whenever, of course, still dark, dark stormy clouds do come now and again, but it's much smaller, it's much more tiny, and you are now much more aware, and you also know how to just clear it like that, right? You don't feel the fear, the worry. You literally can just eliminate it, right? Or even if fear does come along, you're like, yep, all right, fear, what is it? How can I help you? This is emotional regulation. Okay, and when you go deep, this is actually suicide prevention. This is deep emotional healing, and most people don't learn this. Most people don't know this. And when I was mental health director in the CCG, like I love that role, and I learned so much. But I felt like there was only so far I could go in, like everything I'm teaching, like how I don't know how I would deliver that, right? Because it's delivered in a different way, and that's why I set up my own company, right? The Dr. Vidya Global Institute, to teach it in this way. So yeah, so then most people from that program, lifestyle, then are like, I want to do my own thing, and then they normally graduate into legacy creators. But what a lot of people doing now, my clients, is they're doing both. They're both doing both together. Either it's a 6-month, or they're doing the year long, which is super powerful to be in this energy, to be in this material, to be in this with me as well, helping you alongside for a whole year is super powerful. So questions. Thank you for sharing this side of with us. You're most welcome. It's an absolute pleasure. And this is it. This is about being your authentic self. Loved it. Question. What would you say to people who keep recreating illnesses because it takes the demands of relationships off from them? What would you say to people who keep recreating illnesses? If you're recreating it, it's because there's an awareness piece there, right? So they need to go within and look at that block, because they're basically healing, and then they get to this point and they don't believe that they can ever go past that point. So what does it do? That they self-sabotage, but they may not do it on purpose. They may not think they're doing it on purpose. And then the healing, it goes back down again. So they just do this. What we need to do is remove this block. So you just keep on going. And sometimes growth doesn't always look like this, right? It kind of looks like, but if you stand back, you are growing. It is getting better. You are healing. I didn't understand the bit when it says because it takes the demands of relationships off them. So if that means that someone's kind of tapping out of a relationship because they're saying, I've got like illnesses, I've got issue, that's their way of coping or not coping. So this is all about emotional regulation, okay? And then when there's difficulty in a relationship, or if it's a relationship with a lot of responsibility, like parenthood or things like that, some people may use work or health, even subconsciously. It's not like they're meaning to, but they may tune into something like, oh, but I can't, how can I possibly attend because there's this meeting and it's not, and they've attached a lot of scarcity to their work as to why they can't do it. But really it's because maybe they can't cope with this particular way of managing the kids, or like managing something at home, or some really difficult issue that's come up in the relationship that we like need to have a chat about, and something they're busy. So sometimes it's actually around fear and scarcity that it's easier to run away. It's fight or flight response, you know. That's my thoughts on it. I notice the minute I start healing, people start to have heavy demands on me to attend to their lives, visions, desires, needs, and soon I start to feel ill and burnt out again. Okay, boundaries. You are most likely, if you're in this, you're most likely an empath like me. All right. And that is a good thing. Like for years, I was told, you're so sensitive. You're really, really nice, but you're so sensitive. And it was true, because at that time, I didn't have a boundary, or not a strong boundary. So I would also be running around to this person, come here to my baby shower, come to the wedding, can you help me with this, can you help me with that, and they come down there, can you pick me up, and then blah, 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 blah. And I would go and do it because I thought that's what being a nice, Asian girl would do, right? You make people happy, being a good girl. But then when you start to become like a mum, and you're married and you're a doctor and you've got your own practice, and you've got your CQC coming up, and you've got all these things, you start to realize, hold on a second, well, I've got my own thing going on now. And suddenly it's not convenient for other people for me to be living my own life. Okay. And what we need to do is get rid of this codependency. Like, of course, we be there for other people and love them and help them. But the best way to love somebody is for them to learn to do it themselves. So the whole example of, you don't give, say this wrong, this quote wrong now, but it's along the lines of, instead of giving a man a fish, which you'll then have to just keep giving to him when he finishes the fish, right? Because he's like, oh no, the fish is gone. Like, what do I do now? Instead, you teach him to fish, because then he has an infinite supply of fish, right? Or food, or, whatever it is. For me, with my kids, teaching exactly what I'm teaching you is what I teach this to my kids, and they are 3 and 5. Okay, they're 3 years old and 5 years old. And this, for me, is the greatest gift I can give to them, because teaching them about character and healing and emotional regulation and deep empowerment, that all comes from within. Like, yeah, if you want to be a doctor, go and be a doctor, and you can go and be a badass one, and go for it, the top positions, and go for those things, but don't attach your self-worth to that, right? Love that person, be in a beautiful relationship, but don't be this whole two become one thing. You be whole in yourself. So I would say that there is a paradigm, there is a dynamic here, a power dynamic going on here. And the words that you're using. Okay, so not that there's something wrong, but this is also our perception of it. And then these other people will have their perception of it. And then there is just what we call truth. But all truth is what you're seeing and what they're saying. And then this thing here is just fact, or it just is. Okay, the situation. So you're feeling it's heavy. So that means you need a boundary. Like here, you're feeling heaviness. So that means your boundary needs to be here, where you don't feel any, it's not a demand. Or it's a demand, but it's something like, yeah, easy, doable. So you need boundaries, and you need to figure out, what does that look like? Boundaries for me is, I gave you an example with the coffee, and I'm sorry, I'm busy, I've got an urgent appointment. It's no one else's business what that urgent appointment is. You're not lying, you're not doing anything wrong. You are just safeguarding your health, wealth, and your happiness. So that when I've had my full cup of coffee, I'm much more useful to my patient. I'm just kidding. But like, what I'm trying to say here is, when I filled my cup with not just coffee, but with self-love, with confidence, what does that mean to me? It means in the morning, I would like an hour. Sometimes it's not an hour. Sometimes it's like 10 minutes. Sometimes it's 30 minutes. It's like, it's a work in progress. But I want that time to meditate. Like, don't talk to me in that time. Okay. I want that time to meditate, to connect with source, to realign myself with my goal in my health, wealth, and relationships, but starting with immense gratitude for where, and genuine joy and love for where I am right now in my health, in my career, in the way I'm serving, in my way I'm serving as a GP, in my relationships with my hubby, whom I love, and enjoy the gratitude right now for where we want to go, right? So you don't imagine, it's not a future self. It's here now. It's inside you. You're just realizing it. You're becoming that version of you now. Or let's not even say becoming, because that also sounds like it's not here. Like you're always becoming. Like, no, you are there now, right? That version of you who feels no demands from anybody, because you have really beautiful, healthy boundaries. It's called healthy boundaries. It's not something to judge. I have healthy boundaries with my kids. Sorry, darling. He's like 3 or 5. Sorry, darling. I love you. But right now, mommy's having a shower. I can't play with you. Or mommy's meditating. Right? Mommy's meditating. I'll be 5 minutes. And I'll sometimes show him on the timer, the clock. See, it says 5 minutes. When the number comes to this, mommy will be with you. Give me 5 minutes. Here, you can go and watch this or play with your toys, or etc. Like, if I tend to him every single second, then he will also learn that as soon as I ask mom, you should come straight away. I'm like, I will. And most of the time I do, but there are certain times when I don't. And that's because this is for my health. And sometimes I say to him, you like having a healthy mummy, right? He's like, yeah, of course. I'm like, okay, darling. So this is making mummy even healthier, or this is keeping mummy healthy. So he understands when I'm like, yeah, I'm doing my exercise. I'm going to the gym. You're going to kids club for an hour because I have my boxing class, right? Or I have yoga, or I'm going for a jog. So you're in kids club, and it's like the world's most amazing, beautiful kids club, like in some luxury sports club, right? And I'm grateful I can provide that experience for them. So I don't feel guilty in any of that. Right? I just saw it was 111. The question that you answered was that 111. So whatever this question that you've asked is, look up 111. Whoever wrote that, sorry, it says Facebook user, so it won't show me who it is. Let me see if I can show. It just says Facebook user. Okay, sorry. But the question was written at 111. Okay, 11 minutes past 1. So when you look up angel numbers, 111, this is where belief and faith and trust comes in. Okay, I wasn't like, oh, but I'm from a Hindu background, I can't look at angels. Like, no, it's all just universe and source and faith, and keep an open mind. And this is all just connection to myself in different ways, right? So it means spiritual awakening, that you're here, I think you're going through a spiritual awakening. So what happens is you suddenly gain amazing clarity as you're rising up, right? Phoenix rising. Have you seen the logo for my company? It's a phoenix and it's rising up. Yeah. And it's like over a mountain. It's a triangle. It's different geometric symbolisms, but for me it's kind of like a mountain, and the eagle is the phoenix is like, it's not a phoenix rising, it's phoenix risen. So you're in a spiritual awakening of sorts. You're gaining clarity as you rise up or risen. You now start to see how other people are acting, and some people don't even realize it. Some people do, right? So healthy boundaries. And can I tell you something? People are not going to like it. All right, get ready for people to not like it, because they're not used to you probably like really rising up and being like, sorry, I'm busy. They're like, huh, what do you mean you're busy? because you've never before, like, sorry to say, you probably never really put yourself first. So what happens is the way we treat ourselves is the example we're giving to people of how you should treat me. Okay? Write that down. The example, the way I treat myself is an example of to others of how they should treat me. So if you don't have healthy boundaries, you're always compromising on your health, your wealth, your job, your everything, then they will also think it's okay because you did that to yourself. They may not say that, but subconsciously, that's what they're really thinking. So then they start to act that way. And then it becomes a habit over years or, a period of time. And so when you suddenly change up, which is absolutely what you should do, this is where the coaching comes in, right? Because we go through practical strategies and what to do, and you have the energetic support, and you're in a confidential mastermind to actually hold that space for you. Because when you're rising up, often the people around you really don't understand what's going on. And that can feel initially, when you're at the very beginning of the journey, it can feel a little bit scary because it feels like you're doing something so out there. So what do most people do? They pull back and they just regress and they just stay where they're at because it feels comfortable, even though it may not be what they want anymore. But they're like, well, at least I know, the knowing devil and all of that. Forget that. We're not here to survive. We're here to thrive and live life on our terms, right? It's time for you to take back your power. Yeah, take back your divine power. Create some healthy boundaries. You don't have to get angry about it, but you just have to pull back. You need to imagine this is you and this is them, and there's a cord between you, right? All our relationships, there's like it's 111. Oh, it's 1 hour and 11 minutes. 111 keeps showing up. Okay, so this you should definitely look up angel numbers 111. Look it up on Google Images and find one of the banners, the Pinterest thing that resonates with you, and I would screenshot it and I would just look at it every day. And just follow your intuition. This is what following intuition means. So you have to see that there's like an energetic cord between you and them, or you and the situation, and it's invisible, but it's like an umbilical cord. You need to cut that cord, baby. Cut that cord, because you're going up, and then like my kids used to wear that, what is it? That toddler thing that you put on them, and then they try and go far away, and then they just bounce right back. Okay, that's like an energetic cord. So you are rising up, but it's like you've got this cord attached, like that toddler one. So then you just keep bouncing back down again to their demands. Change the meaning. What are your demands? Not on them, because you don't have to do that. But for yourself, what do you demand of yourself in your health, in your wealth, and in your relationships? And start with a relationship with yourself. Just go within. When all of this is happening, go inside. Don't even bother getting angry at other people. None of this justifies anything that somebody may be doing to you or saying to you or treating you. It doesn't justify it. Nope, it doesn't justify it. However, the longer we sit in anger and injustice and all of that, it's not a good vibration. It's literally our cells are vibrating at that angle, at that frequency. It's not healthy. So just let it go. Like, you scream, shout, punch a pillow, go into your car when you're by yourself and just scream, like, do all of that, okay? Because you need to, right? That's why I do boxing. Okay, so go boxing, go for a jog, this is why exercise is so important for anxiety, right? This is why doctors recommend, this is why we recommend exercise for anxiety. Why? Because you need to release that aggression, right? Whether it's anxiety or anger, whatever it is, you need to release it in some shape or form. All right. And some people, they want like the flow of yoga. Sometimes we want that. Sometimes we want to punch a punch bag. Sometimes we want to go for a jog, and we need to physically, because your body is wanting to express it. That's what expressing yourself means. But if you don't express your emotions and you keep it within, what happens is it starts to express it in symptoms. Okay. Your body starts to express it in symptoms such as panic attacks, tight throat, tingling, stomachache, bloating, migraines, random body pains. All over body pain is all over emotional pain. Okay, that's what it means. It means, can you please heal your emotions like now? And what will happen is, the longer this is just left like that, of course, it does start to develop into actual diseases and actual conditions. Okay, so when your mind is not at ease, your body is not at ease. Okay, and in this case, the body is not at ease, it's in dis-ease, it then forms a disease. Do you get it? Yeah, it's hyphenated, dis-ease, disease. So when I'm seeing all these patients, like I'm going to some afternoon clinic now for GP, as a GP, and I probably, can't really talk about my coaching, right, in this specific platform, because I'm seeing them as a GP. See how society works. Interesting, isn't it? The one thing that can actually help them. Anyway, not the one thing, but one thing that would really be very empowering for them. Anywho, but I basically talk about the same concept anyway, because I can't help it, because I'm like, this is actually help. This is what you need, right? But basically they can have referral for therapy instead. And I give them lots of books and resources to help. Okay. But most of my consults, whatever symptom that comes through, including kids, kids, when they cannot always even adults can't always articulate the emotional pain they may be feeling. They may even realize they're in pain. They may be developing abdominal pain because there may be arguments going on at home between mom and dad that they're watching or they're hearing, or they don't even understand what it's about, but they can feel that discord, that disharmony, and that they can't express it. It's not like they're going to sit there and journal and meditate, or talk about it, or you can't guide them through that if you just don't have the emotional bandwidth for it. So what do? It comes into an actual physical symptom. For example, abdominal pain. If you look up abdominal migraine, that's a real thing, and kids get abdominal pain, like actual pain, and constipation, because it's basically a form of emotional pain. Now, there may well be that they're being fit for fussy eater, and it may be nothing to do with any of that situation I said, but definitely that needs to be addressed. It's like so important. So what you need are boundaries, okay? And heavy demands on me, so you need to change that up. What are these demands? And if it's heavy, why do they think it's okay? So I wouldn't even go and have an argument with them about why do you think this is okay, but just because they're either not aware or they're doing it on purpose. Don't go outside, go inside. Why am I allowing this? And then switch it. So don't get angry, or get angry, punch. Punch a punch bag, go for a jog, come back home. And then, because release the emotion, and then be like, okay, so what is the opposite of heavy demands in a relationship? What's the opposite? It's deep understanding. Yeah, it's recognition and deep respect for each other. It's affection, it's love. It's instead of them demanding things for you, they're doing things for you. So they're thoughtful. So what is the opposite? You may even need to look this up on a thesaurus, which means it gives you different words for the same meaning. Okay, so instead of happiness, it might be joy, it might be gratitude. Yeah, so you may need to look up in the thesaurus, what is the opposite of this situation? Like the word, like demand, what's the opposite of demand? Instead of heavy, what is the opposite of heavy? Even healing, right? Because we don't want to stay in healing, because it means that there's, we want to be healed, full stop, it's done. So I'm thriving, I'm empowered, I feel amazing. And the people that I'm around me are thoughtful, they are affectionate, we have healthy boundaries, they respect my time, my energy, my space, my opinions. And they take responsibility for their health, their wealth, their health, their wealth, their relationships. And this is mine. And yes, we're here to be compassionate beings and love each other and help each other, but it must be done in a healthy way. Okay, I have to do this as a doctor as well. I've got to take my time to do my thing. If I have a difficult patient, or sometimes they're not being difficult, but they are in difficulty, so they are expressing themselves in like not the best way, and sometimes they're rude, sometimes they swear, sometimes they hang up. Okay, and it's not me, it's because of what they're dealing with. They haven't expressed it, so it all kind of rises up in the console and like give it to you. It's called transference of emotions. But because of the work I do in emotional regulation, I'm aware of that, and I'm aware of my own boundaries as well. And I can also articulate myself. This is all about communication as well, but also of what's appropriate. Okay. And I will also take my time. I won't rush into the next consult. I will just be like messaging the admin team, like, I'm going to be taking 10 minutes out to make a cup of tea and like have a shower. No, I won't have a shower, but I know I need to realign my chakras. Okay. I need to realign my chakras. I need to energy cleanse. And I might literally go and wash sometimes I literally go and wash my hands. It's like, it's just a ritual. It's not OCD, but it's just a ritual of like, or I just even not pretend, but I don't even use soap. I just imagine water's flowing over it, and it's flowing over me, and it releases anything that's not for me. My aura is warrior strong energy. We do this. This is the embodiment sessions. It's exactly what we do every single week. So it's a strong warrior golden light all around you that's impenetrable to anything that doesn't serve you. And so there's nothing comes in. Also, we don't want to be exposing ourselves to that again and again. But at the same time, if it does come, it's like, it just bounces off. It actually, but that's what Buddha says. Actually, when you're angry, it's like holding a piece of hot coal, thinking it's going to hurt the other person. It's like drinking poison and thinking you're going to kill somebody else. You're actually just doing it to yourself. Or they are thinking they're doing it to you, but actually they're doing it to themselves. So there's no need to ever feel burnt out or ill. You have boundaries. So I would literally just write it down, a specific situation, and you have like different bubbles. So this is the situation. Do I have an example? I think I have one from when I did that in our last session. Let me just see if it's in this journal. So many journals. Okay, right. So for example, what you do is you have your, there you go. So you write down in the middle of the page, a circle or a bubble, and you write down what the situation is, person, event, relationship, whatever's going on in its entirety, everything about it. Okay, or in bullet points or whatever. And then you have these bubbles around, and each bubble you write down all the feelings you're having to do with it, like pissed off, frustrated, scared, anxious, hopeless, whatever, whatever it is, write it down. Okay, so you write it, you're just looking at the emotions, and I see these as clouds, and the cloud can just pass by, and behind all of this is a sunny day. Okay, and which means peace of mind, the opposite emotion. And then what you do is you take that piece of paper that we just talked about. You can see I did one before, and you then write down the opposite. Okay, you might need to look at that piece of paper and look at, okay, what would be the opposite of this situation? Like I said, literally look up the word in the thesaurus or think of the opposite word. So instead of being frustrated, you say, I feel fulfilled. I'm fully expressing myself as me, my divine self, fully shining my light bright. And then you write the opposite situation. So even if it seems crazy and this person's being so difficult and narcissistic, whatever, what is the opposite? Okay, and you don't have to put their name on it necessarily, but it's just like the opposite. So thoughtful, affectionate, kind. They see me in my authentic self and my amazing divine self, and they are proud of me and they love me for me. And it's not that you need this connection, it's just it'd be nice to share it, but I don't need it. And then what you do is that other piece of paper that we talked about, the one that you don't like, that burn it. Okay, burn it, tear it up and burn it. And I strongly advise, this is actually the homework for today. Okay, tear it up and burn it. And I would love you to post your video. I'm going to do it as well. Post your video in the group of you tearing it up and burning it. Okay, and just say in yourself as it's burning, say, I've made a decision that this situation is done, whatever that means for you. You may not even know exactly what that means, but you've made a decision, it's done. So energetically, you're like, I left the building. Okay. And then you focus on this, which is the opposite situation. Okay. And you can look at that every day. You can keep it in your journals. I've done here. If you want, you can post it in the group, and it's all confidential, and we give you that support as well. And this is exactly the thing that we do. If you want to join and enroll our coaching program, I would strongly advise you to do it now, because the next 3 people that do will be getting a one-to-one healing session with me. Absolute bonus. And by the way, when you get the lifestyle program is 4,888 for 6 months, mastermind group program. And so is the Wealthy Warrior Legacy Creators. That's also 4,888. Okay. It's for 6 months, right? Twice weekly coaching. So you have your coaching and then you have the embodiment session. All right. And on top of that, you have a Voxer mastermind. So Voxer is literally where it's an app. Show you it. It's an app, and don't show you my other clients, but it's an app like this, and you can literally send like voice notes. See, you send a voice note and you just play it, and you say, oh, I've got this situation which is happening at the moment, and like my husband or this person or whoever did this, and it's so difficult. I don't know how to incorporate the teaching from today on a practical level, and I'm finding this really difficult. And then I get reply, okay, within like business hours. So you don't have to wait a whole week for the next session to get an answer. So although it's group, there's a hybrid there. So I'm obviously only replying to you. So it's one-to-one, but in a group setting. So beautiful hubby there. Say hello. My phone, see? Everything's always works out for me. So we have that, and each program has its own Voxer. But when you purchase both of them, which is super powerful, so you're like, I want to start my own, I want to be a lucrative life coach, I want to become a published author, I want to be making 30K and beyond in like 3 months, and I want the deep embodiment sessions and intensive and really becoming warrior strong in my mind, in my body, in my soul, deep healing, and becoming like a leader. And it all starts within. When you do both of them, which is super powerful, then you get a huge discount of like a whole grand off. So it will only be 8,888. Okay. And there are payment plans as well. So just check the link. The links are all there. It's all there. Or just DM me if you've got any questions. We could jump on a call or just whatever questions you may have. Now the year long is beautiful, right? So the year long program, that is 10K at the moment, but it will be going up to 20. And that is phenomenal, because with that, you will not only get everything I've just said. Okay, so you get the group embodiment sessions every week. You get your actual coaching for each program every week. You get the Voxer Mastermind, so you can ask questions anytime. But you also get monthly one-to-one, one-on-one embodiment sessions. You can have it as a coaching session if you want. So it's super powerful. You're the first people finding out about this offer, and the offer ends on Sunday. So on Sunday, all the videos will stay in this group, but that's kind of the end of it being a free masterclass, and then it becomes a paid program on its own. So you can just have this heal and release masterclass on its own if you want. You can just have this on its own, which I strongly recommend, because you can watch. Repetition is a mother. Repetition is a mother. That's how you gain mastery, and you can pause and repeat things. And I advise you get the mental health workbook as well, which is coming in next week. And that's a beautiful little combo, like really heal and release masterclass, the workbook. And I mean, I would advise that you definitely enroll in Wealthy Warrior Lifestyle. It's phenomenal. And like I said, it's award winning as well. So it's award winning for that reason. So the year long, you get it every single month, and you get personal coaching as well. So anyway, that is the end. I'm going to start my afternoon clinic now. Send you so much love and light. Do let me know any questions that you have in the group. You don't have to just wait for the live sessions. Just post it in the group, and we'll take it from there. All right. Send you so much love and light, and we'll catch up soon. Take care.